Thank you, Akiba. My name is JJ Straight. My pronouns are she, her, hers. And as Makima mentioned, I am the Deputy Director of the ACLU's Liberty Division, which sits in our National Political Advocacy Department. And really excited and thrilled to be with you all today. We're going to discuss the ACLU's nationwide reproductive freedom efforts and the work ahead of this year's midterm elections. As you all know, we really are at the edge of a precipice. In the coming weeks, the Supreme Court will be issuing their decision in the Dobbs versus Jackson's Women's Health Organization, or as some of us have shorthanded to JHU, which is a direct challenge to Roe versus Wade. And as we know from the leaked draft opinion, all signs are pointing to Roe being overturned or completely gutted. And to lose this federal constitutional protection signals to all of us the urgent need to protect abortion access state by state. So that's what we'll be discussing today with my colleagues who are on the front lines of this work. So I'll ask our panelists now to turn on their cameras and wave hello as I introduce you all. I am joined today by Alexis Kolbi-Molinas, a Deputy Director in the ACLU's Reproductive Freedom Project, Amber Duke, the Interim Executive Director and Deputy Director at the ACLU of Kentucky, and Jessica Ayoub, Public Engagement Strategist for the ACLU of Michigan. Before diving in today, let me start with a quick note that this is an off-the-record conversation. If you're a journalist amongst us, please note that nothing that's said here is for attribution or citation. It's really important for us that this feels like an intimate forum and a safe space for all of you to raise your questions. And we have purposely assembled you today, this group of our leadership supporters nationwide, for this exclusive briefing, which is designed to offer you an inside look at all our response plans. And so for today, we're going to, through today's conversation, we're really hoping to answer your questions around the landscape of reproductive rights at the federal level, how we are preparing to fight back at the state level in all of our states, the critical role that advocacy, organizing, and our public outreach will play in the months and, frankly, the years to come. And I want to make sure to note that we will also be leaving time at the end of today's discussion for you to ask all your questions, again, using that question and answer Q&A feature at the bottom of your screens. And so I'm going to jump right in with Alexa, and Amber and Jessica will be asking you to join us again in a little bit here. So Alexa, I want to chat with you about the JHU Supreme Court decision, what it means and how far-reaching the impact could be. You were recently on CNN with Christiane Amanpour to discuss the very horrifying consequences if indeed the Supreme Court's ultimate decision is anything like the leaked draft that we saw. You stated that the impact is not going to stop with abortion. Could you explain the domino effects that this will have?
Sure. I think for many of us, when we saw the leaked opinion, our first response was that it's confirming our deepest fears, right? That this Supreme Court is prepared to take away our ability to control our bodies and our lives, and to allow states to criminalize people for obtaining and providing essential health care. We have seen the devastation that an abortion ban has caused in Texas and now Oklahoma, and that nightmare could soon be a reality for millions more. But this is about so much more than abortion, and it goes beyond states like Texas and Oklahoma. Never before has the Supreme Court taken away a constitutional right that it previously recognized, let alone one that has been recognized like abortion for nearly 50 years. So if the Supreme Court can do that with abortion, then there is nothing stopping it from going after other rights. And the leaked opinion really showed us that. Because when we are thinking about fundamental rights to make deeply personal decisions about our lives and our bodies and our families, our rights are interconnected. And Roe v. Wade has really been a load-bearing element in that framework. The right to birth control, the right to form intimate relationships and marry the person that you love regardless of gender, the right to gender affirming healthcare, the right to access healthcare services like IVF. All of that is at risk if the final opinion in Jehu looks anything like the leaked opinion.
Right. I mean, you really did outline that this isn't just a concern about some people in some states. It really is, this decision, as it was outstated or stated in the leak, really would be dire everywhere. In the wake of such a huge moment, we know that we're going to need really loud and, most importantly, sustained public outcry, and that we'll need to use other legal avenues to really break through. So I had another question for you. Without those constitutional protections, it's very clear that the federal courts, are not going to save us when it comes to abortion access. However, we know that there are alternative tactics to take at the state level. Can you tell us more about some of the legal avenues and opportunities that you and your colleagues at the ACLU are exploring?
Absolutely. I think there's an understandable focus on federal courts and federal judges. I mean, when you think about the power the US Supreme Court has, that's understandable. But I think what a lot of people don't realize is that the federal Constitution, the US Constitution, is just a floor. It's not a ceiling. And state constitutions can and often do provide greater protections for their citizens than the federal Constitution. It's just that we often need litigation to force them to realize that promise. And these are tactics that we use today. I mean, just last week, we brought a state constitutional challenge in Florida, challenging a 15-week abortion ban. Last year, we brought a sweeping challenge in North Carolina under the North Carolina Constitution, attacking numerous restrictions that over the years have systematically reduced access to abortion in that state. And these cases, these claims, they're independent of Roe. They are independent of the US Supreme Court. And so if we're successful, we will have not only protected, but expanded access to abortion in a very critical region of this country. So if Roe is overturned and the courthouse, the federal courthouse doors are finally closed on us, then we're just going to redouble these efforts to use state courts and state constitutions. And fortunately, we can do so alongside our affiliates who really have the expertise in state courts and state constitutions to continue to fight back.
Yeah, I know for one, I was excited to see that alert come across my phone when you guys filed in Florida. And so if Roe is overturned, we know that taking an intersectional approach in both our tactics and working across different movements and states are going to be critical to the fight. And the ACLU is uniquely situated and equipped to do just that, because we are an organization that is covering the waterfront of civil liberties with legal and advocacy networks in all 50 states and Puerto Rico and the District of Columbia. And so now I'd like to invite Amber and Jessica to come on screen. And thank you, Alexa. I'll be bringing you back later in our discussion. Excellent. Welcome. I'm going to pivot first to you, Amber. Earlier this year, Kentucky had a grueling 8 days with no abortion access across the entire state, which is a preview of what many states will face if Roe is overturned in this decision. On May 19th, the federal court in Kentucky granted a request from the abortion providers in that state for a preliminary injunction, which then reinstated access, at least for now. Can you tell us about that experience on the ground in Kentucky?
Sure, thanks for that question. I think it's important to note that even with Roe in place currently, even with the constitutional right to abortion, it has been incredibly hard to access in states that are hostile to abortion, like Kentucky. Kentucky is a state that only has 2 abortion providers. Both of those providers are in Louisville. So there are many barriers that rural folks face, poor folks, other low-income folks to travel to Louisville to access abortion. We have an incredibly hostile General Assembly, and House Bill 3 is the bill that you were referring to that shut down access to abortion care in Kentucky for 8 days this spring. When I talk about House Bill 3, I refer to it as an abortion ban by red tape. It is a 60-plus page bill with all sorts of regulations that are targeted specifically at abortion providers. And there were two unique features of that bill that shut down access here in Kentucky. The bill had an emergency clause attached to it. So our governor vetoed the bill when it initially passed the legislature, and then the Kentucky General Assembly voted to override the governor's veto. When they overrode the veto, the bill became law immediately. The bill also includes impossible barriers for abortion providers to meet. So, for example, there are several regulations that require abortion providers to fill out specific forms before they can provide services, and those forms do not exist. The state agencies that have been charged with creating those forms have not created them. So when this law went into effect, there was literally no way for providers to be able to comply with the law. Our attorneys here at the ACLU of Kentucky work really closely with Alexa and her team. Our coalition partners at Planned Parenthood also challenged this law, and we were able to secure that preliminary injunction. During those 8 days, there were a number of people who were not able to access services. So folks that came to our client at EMW Women's Surgical Center, they didn't meet with doors that were closed. Providers did not take a vacation during this time. Folks came to work. They were on the phones, answering questions, working with folks who came to their door. So we know that about half of the folks that were seeking care during this 8 days were able to move their appointments until later. And after the preliminary injunction was in place, they were able to receive the care that they needed. We know the other half of folks required assistance from other coalition partners like the Kentucky Health Justice Network that worked to get those folks out of state to get the care that they needed during those 8 days. So it was a preview of things that are to come. It took communication support from the ACLU, support from the A Fund and Abortion Fund, folks that are on the ground here in Kentucky that are associated with Sister Song to sort of provide information to people to calm fears and help people get the care they needed during that period.
Wow, thank you for that, Amber. We know that there is no question that we're going to have to double down, triple down really on our advocacy efforts at the local and federal levels. And at the ACLU National Office, as a matter of fact, we are dedicating 80% of our national organizing staff right now towards reproductive freedom to continue to secure wins where we can and protections for abortion access wherever is possible in the states. And this work is largely following the leads of our great affiliates on the ground in the states. So I'm going to pivot now to Jessica to talk about that. Jessica, I had the distinct pleasure of spending a couple weeks with you guys recently in Michigan, and Michigan really is a prime example of a state where advocates for abortion and access are working literally around the clock to protect the will of the people. And we know that if Roe is overturning this decision, Michigan right now has a 1931, you all heard me correctly, 1931 law banning abortion that could take effect again. Can you tell us more about what's the situation right now in Michigan?
Absolutely. Thanks, JJ. So yes, as you mentioned, here in Michigan, we have a law on the books from 1931 that not only bans abortion, but it also carries a criminal penalty for abortion providers. And should Roe versus Wade be overturned or even gutted, this law could go back into effect, which would have an incredible chilling effect on abortion providers here in Michigan. We also have an incredibly conservative legislature that dominates the House and Senate that is not poised to repeal this law. And so recently we saw our Governor Whitmer, file a suit against 13 local prosecutors who have an abortion clinic in their jurisdiction, seeking to block enforcement of the 1931 law. On that same day, the ACLU of Michigan, along with some of our partners, filed suit representing Planned Parenthood of Michigan in a lawsuit similarly challenging the 1931 law. We are very excited to say that we won a preliminary injunction in our suit representing Planned Parenthood, which will blunt the 1931 law from going into effect when the Supreme Court issues its final opinion, and will blunt it from going into effect. The governor's suit is still in process right now. The Supreme Court has asked her to submit a couple of briefs or and answer a couple more questions before they issue any sort of opinion there. But we do have this sort of temporary relief that is having folks breathe a bit of a sigh of relief here. But we also know that this is not a permanent solution here, and have partners across the state working to advocate for long-term solutions to protect access to abortion, because we know that here in Michigan, voters overwhelmingly support protecting access to abortion and this critical health care. And they believe that this should be protected.
Yeah, absolutely. Much like all the states in the country, we know that where these laws are and where the people are distinctively apart, and we need to keep working on that. So I have a quick follow-up on some of the work you guys are doing in Michigan. We really know that at this moment, a multi-pronged approach in coordinating with your local partners and grassroots organizations across a big state like Michigan is absolutely essential. And so can you expand a little bit on that, and like what tools you all are using on the ground there?
Absolutely. So to win this fight, we are bringing all of the tools in our tool belt. So of course, we have litigated the 1931 law and successfully blunted its enforcement, but we also need to galvanize support on the ground and build people power to fight back. So we have joined forces with Planned Parenthood Advocates of Michigan and a local organization called Michigan Voices that represents grassroots organizations across the state to build power in local communities to fight back against these abortion bans and to protect access here in Michigan. In Michigan, a ballot initiative has taken shape called Reproductive Freedom for All, which is a campaign that would amend Michigan's constitution to explicitly enshrine the right to reproductive freedom in the state's constitution. And to qualify for the ballot, Reproductive Freedom for All needs to collect 425,059 signatures, which is oddly specific, but it is 10% of the turnout in the 2018 gubernatorial election. The campaign is knee-deep in signature collection right now, and has until July 11th to collect the required signatures to qualify for the ballot. And Michigan is no stranger to ballot measures that expand rights. And in 2018, the ACLU of Michigan participated as a member of Promote the Vote, which was a ballot campaign that sought to enshrine voting rights in our state's constitution, to include things like no reason absentee voting and a guaranteed period of allowing folks to register up until and on election day. And it's because of that work that on Promote the Vote that Michigan saw its highest voter turnout rate on record in 2020. And if that teaches us anything, it is that when we give voters the option, they take their rights into their own hands. And so we're really grateful for the wins we saw in 2018 and are excited to continue building on that incredible momentum.
Wow, that is incredible momentum. Thanks, Jessica. We also know that right now, abortion access is just one of the many things that conservative legislators are looking to oppress our rights, particularly of our historically disenfranchised communities. We know that there are attacks on women, our trans folks, communities of color, low-income people, and certainly targeting towards rural communities. And I could go on and on. And we see states like Kentucky that are taking this fight for those reasons beyond abortion access. So a question for you, Amber. The ACLU of Kentucky has really been leading this incredible broader advocacy around maternal mortality and protections for pregnant people. And we know that if abortion is to be banned through this decision, maternal mortality rates are projected to rise by 21% overall and by 33% for Black people. Amber, can you tell us about the work to expand the rights of pregnant people and parents, and why will this be so crucial in a landscape, in a world where we might see forced pregnancy be a reality?
Thanks for that question. Earlier today, I was actually speaking to someone who said, will Kentucky shut down their reproductive freedom project if Roe is overturned? And I was like, oh my goodness, absolutely not. We'll be tripling down on the work that we do, especially outside of abortion access, through our reproductive freedom project. So you mentioned the abysmal maternal mortality crisis, and we've been working for a number of years in our legislature to pass some legislation around collection of data so we can get a true picture of what that looks like in Kentucky. And we're also, working on a number of bills that we think are going to have some positive impacts on these terrible numbers. So for example, we had a dignity bill that we passed our last legislative session, which expanded rights for pregnant incarcerated people. In recent years, we were able to get a Pregnant Workers' Rights Act passed. And so we challenged some of the anti-abortion folks in the General Assembly and said, well, you want to force people to be pregnant, you want to force people into parenthood, how are you going to protect them during their pregnancy? And so we actually had a legislator who votes for a lot of the anti-abortion bills that came through. And she stepped up and actually was the lead sponsor of the Pregnant Workers' Rights Act. And we got that over the finish line. So I'm really proud of that work. We will really be deepening that work. And I do want to just quickly mention my colleague, Jackie McGranick-Tan, who is our reproductive rights policy strategist, has been doing some really innovative work in community and has put together a group called the Breaking Barriers Council, which is a group of, it's all Black women at this point who are birth workers, who are doulas, who are counselors, therapists, who are just on the ground doing this incredible work in Black communities across Kentucky. And so if we're looking at a landscape of forced pregnancy, these are the folks that are on the front lines that are going to be giving information to people, getting people to resources. And so I've been really proud of the work that we've done here at the ACLU of Kentucky to bring those folks together and to help them, learn from each other and to help them gain resources.
Wow. Yeah, that's incredible. We know that in this moment, those kinds of community efforts are going to be more important than ever. Thank you for that, Amber. We know it's going to be really critical to remember that protections for pregnant people and parents are not separate. They're absolutely part of this fight. So thank you. Before we jump into our next round, I just wanted to remind all of our folks who've joined us today that you can be submitting questions through the Q&A feature. If you have something that comes up as we're going along, please go ahead and just type it right in there, and we'll get to as many of those questions as we can in just a little bit here. Alexa, I was going to ask you to please come back and join us, and Amber and Jessica, I'll ask you to stay, and we'll get into some more work that we're doing here affirmatively. So Alexa, basically, despite the fact that we know, and we've heard now, that half the states are really poised to pass bans or already have bans that'll go into effect on abortion, we are seeing states taking incredible affirmative actions as well that really will lock in and protect the right to abortion in their states. Can you please expand on these protections and how they're going to impact access across those states if Roe is to be overturned with this decision?
Yeah, I mean, fortunately, we really are seeing several state legislatures step up this year to take steps to protect and expand access to abortion in their states. For example, in Maryland, Maryland recently joined many other states in authorizing qualified clinicians like nurse practitioners to provide abortion care. They've established a fund to train and diversify the abortion workforce, and they've plugged gaps in public and private insurance coverage for abortion in the state. Connecticut, for example, has also, like Maryland, authorized qualified clinicians to provide care, again, expanding the number of people who can provide abortions, which will be that much more important when there's a greater influx of people to these states seeking care. And Connecticut has also really led the way in instituting measures that seek to protect providers in Connecticut, patients traveling to Connecticut, people who help patients travel, to try to protect them from legal overreach from states that are hostile to abortion and may well criminalize abortion in the next weeks or months. Colorado has codified the right to abortion as well as other forms of reproductive health care. Remember, we were talking about the interconnected framework of our rights. Well, Colorado has codified a right to abortion and other forms of reproductive health care into their law. So these are just sort of some examples of the really positive steps that we are seeing to respond to the moment we're in.
As a born Coloradan and somebody who lives here today, I was really pleased to see us codify the right. And as you said, also make sure that there were protections beyond just abortion when it comes to our reproductive autonomy. I have a follow-up for you. Although we know there are these they've been called quote unquote safe haven states, we know that the obstacles to providing care in these states, like the Colorados, the Connecticut's, the Marylands, are still going to be tremendous, right? So can you please talk a bit about the challenges that those states will face even as they're passing these protections, and really the barriers that people may face in crossing state lines?
Yeah, I mean, look, again, these are wonderful and important steps that states are taking, but we know it's not a silver bullet. I mean, first of all, there's the issue I mentioned that Connecticut is trying to address, but that people in many states, these so-called safe haven states, are going to face, which is the risk that providers in those states, people traveling to those states, people who help people who travel, the risk that they face legal overreach from hostile states. I mean, we already saw Missouri this year introduce a law that would make it a crime to travel out of state to obtain abortion care. And so that's the sort of risks that even in these so-called safe havens, people are going to face. And then there's also the reality, as you mentioned, which is that there are already large swaths of this country where abortion access is unavailable and people have to travel great distances to get care. And we know that those burdens for far too many people are just insurmountable. I mean, put aside for a moment the cost of the procedure itself, which most insurance plans, if you even have insurance, don't cover. There is the cost of lost wages, taking time off of work. Do you even have a job to come back to? I mean, how many people seeking abortion care don't have access to paid sick leave? There's quite a large number. So they may lose their job even requesting the time off they need to travel to get care. There's childcare costs. We know that the majority of people who have abortions already have at least one child. There's transportation costs. Do you have a car? Is it reliable? Can it travel long distance? Can you afford gas these days? Can you afford a plane ticket? Are there buses that go where you need to go? And how many plane tickets and bus tickets do you need to buy? I mean, think about how many times you go to just a simple medical procedure, even in an office, and you're told that you need someone else there to pick you up. Well, so now if you're traveling hundreds of miles to get care, it might be more than one person who has to pay to travel to get that care. Hotel costs where you're going. Sometimes abortion procedures take more than one day. Sometimes people end up going to a place where there's already a mandatory delay and they have to pay for hotel costs. And I've heard from providers who talk about patients sleeping in their cars in the parking lot because they don't have money for the hotel. There's food costs just of food while you're traveling. I mean, I remember hearing a story from a woman who had to travel hundreds of miles to seek abortion care. She was about to be deployed to Iraq, and she had spent all of her money, what little money she had in her bank account, buying the supplies she needed. And she slept in her car and ate saltines for 3 days because that was the only way she could scrounge up the money for the procedure. And just for far too many people, they just can't even make that happen. And then putting aside the costs, think about people who have to keep their decision to have an abortion secret. Maybe it's from an abusive partner, maybe it's from unsupportive family members, maybe it's from their employer because they're afraid of being retaliated against. It's very hard to take an extended period of time away from your home, your family, your job, from school, without telling people why you're doing it. So all of these things together, these burdens, can just simply make it insurmountable for people to get to where they need to go to get the care they need. So while, again, it's incredibly important for states in these so-called safe havens to step up and to do the right thing, which is to protect and expand abortion access, we just know that that's not going to be the solution, and it's not going to be the only thing we can do.
Yeah, absolutely. I think we've also just seen such an influx and overwhelming response from just a couple states who have barred or limited access. And so that's why it's going to take all of us and to continue to think through every tactic that we have at our disposal to continue to fight back on these egregious bans. Amber, I have another question for you. In Kentucky and other places, we know that the legislatures from across the country are basically taking a copy and paste function from those bans, those abortion bans. As you stated earlier and outlined some of the work that's gone on, basically taking kind of a copycat approach. So how is the ACLU of Kentucky working in the courts and on the ground to really block bad bills from passing and then to fight against any of those copy and paste bills in Kentucky?
Yeah, the copy paste function brings things to Kentucky, and we export things out to other states as well. I think the use of the emergency clause in anti-abortion bills, I feel like, was a innovation, whatever the negative word for an innovation in Kentucky that we've seen used in other places. Our work in the courts is extensive. I'm sure Alexa would probably say she never imagined in her lifetime she would spend as much time in the Commonwealth of Kentucky as she has over the past several years, but we even sent her to the Supreme Court in one of our cases recently. So we at the ACLU of Kentucky are so grateful for our partnership with the National Reproductive Freedom Project. We have faced so many challenges and have so many cases at various levels of the courts, and the National ACLU has been an incredible partner to us. There's a lot that is happening in Kentucky. I talked a little bit earlier around the grassroots work and organizing in the ground in communities and support of people. There's a Protect Kentucky Access Coalition that is working to keep anti-abortion language out of Kentucky's Constitution. And one thing that I do want to mention is that, you know, the ACLU of Kentucky is a proud member of the Southern Collective. And for folks that are on who have not heard about the Southern Collective, it is a grouping of the 12 Southern affiliates. We are among the ACLU smallest affiliates. We face, you know, a lot of challenges across the waterfront of issues that the ACLU covers. And if folks have seen any of the maps that have been all throughout the media of sort of what will the map of the United States look like for access, all of the states that are part of the Southern Collective are in those red zones where there will not be access. And so, you know, as the Southern Collective, as a region, you know, we are a group that is rooted in racial justice, and we're particularly concerned about the impact of this ruling on Black and Brown people. Of course, Jay, who originates from this region, but we are thinking of ways that we can collaborate as a unit, as the Southern Collective, both amongst ourselves as affiliates, but also regional collaboration with groups like Sister Song to fight back where we can still fight back and to build power.
That's incredible. Thank you for talking about that Southern Collective and thinking about how we can really ally across movements and with partners in this moment. On that note, Jessica, I wanted to ask you, we saw after the Supreme Court leak a few weeks ago that the ACLU of Michigan experienced a huge swell of support. 30,000 people signed on to take action. I heard this was maybe in 24 to 48 hours. We saw 30,000 people sign up to take action and to defend and protect abortion access in Michigan. Can you talk about how this support from activists and supporters on the ground is helping to protect access right now in Michigan across the state?
Absolutely, yes. So in a week, I wish it was 48 hours. In 1 week, we saw 30,000 people raise their hand and say that they wanted to join the fight to protect access to abortion here in Michigan. We haven't quite recovered from that yet, but are beyond grateful for all of those supporters. And I think to paint a little bit of a picture of where folks are coming from, we truly saw statewide support. It was not just centralized in our major metropolitan areas, but in our rural communities up in the Upper Peninsula of Michigan, which for context is about an 8-hour drive from Detroit, where I'm based right now. Some of our most active volunteers have now formed a team in the Upper Peninsula to mobilize their communities to fight back against abortion bans and to protect access here in Michigan. And what this tells us is that this is a unique opportunity for us to truly embrace what it means to be a statewide organization and to have a statewide presence and an organizing presence across the whole state of Michigan. It also tells us that Michiganders are ready for change. They are ready to fight back, and it presents a unique opportunity for the ACLU of Michigan to build relationships with these activists and sustain those relationships for the fights to come. We know that our rights are not won in one election cycle, and this is a decades-long fight that is going to require long-term relationship building. It is going to require us to build capacity across the state, double down on our organizing efforts, and really sustain the momentum that we have seen in the past month for the next decade and beyond.
Yeah, that's incredible. I know. Thank you so much. We saw some great outpourings all over, and we do know it's going to take a lot of our cross efforts, and that our supporters are truly the backbone of this work. And so with that, I wanted to turn to the folks who are on the call with us today and start to hear questions from you.
Thanks, JJ. If you have any questions and would like to ask your question aloud, please use the raise hand feature found at the bottom of your screen and we will unmute you. If you are joining by telephone today, dial *9 to raise your hand and we'll unmute you. Otherwise, please enter your questions in the Q&A panel found at the bottom of your screen. JJ, we have a few questions that we've collected throughout the conversation, so I'm going to batch a few of them for you to answer.
Great, thank you.
The first question is, how do you work with other groups such as Planned Parenthood and the Center for Reproductive Rights? The next question is, can you talk more about one state trying to criminalize traveling outside of a state for abortion? And the last question for this batch is, how concerned is the ACLU about taking issues to the Supreme Court that have little hope of a positive outcome in light of the negative precedents that will very likely be established?
Thank you for those, Makiba. I'm going to actually start today with the first one and send it out to Amber, Jessica, if you want to talk to us about, in your work on the ground, how are you working with groups, like Planned Parenthood and Center for Reproductive Rights, other groups on the ground in this effort? Amber, do you want to kick us off?
Sure, I was like, it's going to go first. So we've worked in an advocacy space. The ACLU for a couple of decades was really the only organization in the state of Kentucky that was working on reproductive freedom and abortion access in the state legislature. In recent years, Planned Parenthood has had an advocacy presence at our Capitol, and so we are thrilled for their partnership and work very closely with them on legislation. I mentioned earlier the Kentucky Health Justice Network, A-Fund, which stands for Abortion Fund, who are local abortion support organizations local to Kentucky. So we're in close conversation with them. They both are great supporters of our clients at EMW Women's Surgical Center. And so there's often throughout the years, sort of a sharing of information and coordination and updates that happen between us.
Great. Anything to add there, Jessica?
We work incredibly close with Planned Parenthood of Michigan and Planned Parenthood Advocates of Michigan and Center for Reproductive Rights. Works very closely with many of our independent abortion providers here in Michigan. And we are all constantly in communication and working in coalition with one another. Not much different than what Amber described.
Yeah. I'll just note too, at the national level, we're all very coordinated right now. Not just in this moment, but especially in this moment, we're really coordinating on, as we've talked through, the multiple tactics that all of our organizations are looking at, including the response to the actual decision itself. We've been really working in lockstep together. So I'm going to move us on to the next question. Alexa, I might throw this one at you. If you could talk more about some of the states that are trying to criminalize traveling outside a state for abortion. I think you mentioned Missouri. If you wanted to expand on that at all.
Yeah, sure. And actually, if I could just add on to the previous question, I didn't want us to be left out because we lawyers too also work very closely with our partners at Planned Parenthood and the center, and we work very strategically with them. Sometimes we bring cases together, other times we decide to divide and conquer, but it's always very deliberate. And it's a really complementary relationship, right? I mean, Planned Parenthood has in-house medical expertise. We, the ACLU, we're a multi-issue organization. We're not just the experts in reproductive rights, right? We can bring in the experts on the First Amendment and racial justice, immigrants' rights, and our partners really rely on that. And similarly, we're not just a national organization because we have people like Jessica and Amber and all the affiliates. And so again, Planned Parenthood and the center really rely on that expertise as well, not only in the sort of on the ground advocacy, but in the courts as well. So it's at all levels, I think we are really working in partnership with our colleagues at those organizations. To the other question, Missouri is the only state that has that I'm aware of that has explicitly introduced a bill that would do this. But as Amber was telling us, I mean, copy and paste. This is how this works. It only needs to start in one place with one person's bad idea. And then it will spread like wildfire. And so this is something we are incredibly concerned about, whether it's criminalizing people for traveling out of state, for helping people travel out of state, trying to go after providers in other states. Think about providers who might have multiple medical licenses. Maybe they've worked in more than one state, but if they're providing care in a so-called safe haven, is someone going to go after their license in another state, right? And so it's just a web of really sort of, we're in uncharted territory. And so far, the only concrete thing we've seen is that bill from Missouri, but we're very concerned, and it's something we're watching incredibly closely.
Yeah, absolutely. I think it's worth mentioning too that even when these bills maybe don't pass, that the chilling effect that we know that they have, and certainly, of course, also, as you mentioned, the copy and paste function has real world consequences for folks who aren't as attuned into every single thing the legislature is doing. But certainly, I would say, we've heard the quote, the cruelty can be the point, right? Like sometimes we know that just introducing the language and getting a lot of attention around it puts people in incredibly precarious positions as they're making these decisions and trying to sort through all of that, particularly when they're already trying to seek out travel. And so it's another reason it's going to be critical that we continue to weave together in our coalitions and really push back on this politically wherever possible as well. So I I wanted to kind of throw out to the crowd about how concerned we are taking issues to the Supreme Court that have little hope of positive outcome in light of those negative precedents that will very likely be established.
I can answer this too, or at least
Great.
take
That'd
a
be great,
stab at
Alexa.
it. Because this is a consideration that we are always thinking about this. Even when we first bring a case and it's filed in the lowest courts, we're thinking about the Supreme Court. So it is always a consideration of what claims to bring, where to bring them, how to bring them, when to bring them. And so it's definitely something we're considering, and that we balance against the need to advance the law and the need to protect people's rights. I think it's important to remember that, when you think about when the ACLU first started in 1920, courts were actually incredibly hostile to constitutional rights. For example, the First Amendment, the sort of robust First Amendment protections we think about today, simply did not exist. And the ACLU brought and lost many cases until we got to the point where finally we started to see a change in the law. And so, it's a short-term game, but it's a long game too. We have to think about today, but we have to think about the future. We have to think about powerful dissents over the years developing into the majority opinion. And so again, these are just sort of all considerations that go into every decision we make when we're thinking about what cases to bring and where and when.
Great points, I think, about that a lot. And it's also why we have all of those tactics and different layers of where we also, make legal decisions on how we think about the incredible network of legality, organizing, and pushing back at the ballot. Makiba, did we have other questions coming through?
We do. We have a few for you.
All right.
First one of this batch. What does the decision mean for medication abortion? Related, how will mail order abortion pills be regulated given that they travel through the U.S. Post Office, a federal agency? And knowing that abortion is so common, how do we destigmatize and normalize abortion and treat it as the standard healthcare procedure it is?
Thank you for that. So I'm going to start off with what the decision means, or what we know now, what it might mean for medication abortion. As many folks here know, before I kick that off, many folks use medication abortion. It's a safe and very accessible option for patients. And so I'm going to actually, Alexa, I might kick that back to you. We're already seeing some of how this, just like we're seeing with the travel, right, that some legislation is going to be pointed directly at medication abortion. But what does the decision itself mean for medication abortion?
I mean, look, if the final opinion looks anything like the leaked opinion, medication abortion is going to be just as illegal as any other form of abortion. And it's actually right now the majority abortion method used in the first trimester. And it's really grown over the years since it's been available, but the access to medication abortion is going to be just as illegal as accessing any other form. And that, that will play into how people are able to access it through the mails. I mean, look, people are still going to try, and they are still going to find places online where they can try to order medication abortion. And fortunately, that's something that people can use safely on their own, at least medically safely. But legally, it's going to still be risky. And I think, one of the differences between what we're facing now and what things were like at the time that Roe was decided is that there really are safe methods, medically safe methods of self-managing your abortion these days, but it's criminally risky, it's legally risky, and it's the risk of criminalization that I think is going to come even more to the forefront. And so, yes, the US mails might be a federal agency, but they're going to end up in a state, and they're going to end up in a state where it's illegal. And so that's going to be a real risk for people. We know people are going to take it because they're going to do what they need to do, but it's going to be a real risk.
Can I just add one point to that? I mean, I just wanted to say in places like Kentucky right now, without seeing and working with an abortion provider, folks don't have access to medication abortion. So several years ago, 3 to 4 years ago, the Kentucky legislature banned telemedicine for abortion. So I know that in some states, folks are able to kind of like go to a private setting, and there's sort of like a video conferencing that you can do. And like once you complete that, there's a machine that unlocks and you can get access to medication. And that's been outlawed in Kentucky for a number of years. So I know I hear this question coming up a lot, and I sometimes remind myself of like, oh, in other places, like folks are able to access care in this way. In Kentucky, there's also a requirement for a medically unnecessary ultrasound before an abortion. And so again, you know, folks who, you know, want to use the mail to access medication abortion can't do that in Kentucky, because again, you have to meet with the provider and have an unnecessary ultrasound before you can have access to that medication.
Yeah, I know that, and we'll continue, just like we said, to see chilling effects on medication abortion, and or in the states that are going to continue to have some access. I think this is a place that people are going to continue to try to attack access to this very, very safe way for folks to get an abortion. And we will be there fighting that every step of the way. So Jessica, I'm going to kick the next question to you, because I know that you've been doing a lot of work on this in Michigan, and that the ACLU and partners have been really thinking about how to really get at the heart of that destigmatization and normalization of what we know is a common and safe healthcare procedure. So can you talk a little bit about that work?
Yeah, so first I will put on my organizing hat and say that the way to destigmatize abortion is to change hearts and minds, right? And to build relationships locally on the ground, and share the experiences of people who have had to access abortion care, people who rely on this as safe medical care. You know, this harkens me back to one of our new volunteers, Amanda. She is in a rural part of Michigan, and really was brought into this work because of her own experience accessing abortion. She was pregnant, had a fatal fetal anomaly, and she and her husband accessed safe abortion care. And she's brought to this fight because she realizes that her abortion was life-saving, and so many people access this care for very valid medical reasons. And her, you know, her motivation is to make sure that that care is accessible across the state. And so it is really sharing the lived experiences of people who access this safe medical care. It is making sure that folks have access to this safe medical care. And it is making sure that we are relentless in our fight for protecting access.
Yeah, I just want to add a little to that too. I think you hit the nail on the head. It really is about just having those conversations too. I know that in my community, my grandparents are Mexican immigrants, and it was really one was Catholic, and I think I was always hesitant to talk about this in my own community through maybe my own thoughts of what might be resistant to talk about. But in talking to one of my aunts, who also is a first-generation immigrant, because she had lived in Mexico and experienced what happens when there is not accessibility or legal abortion, she was a bigger champion than I ever could have imagined. And then we have now, I mean, I've worked in this movement for 20 plus years, and just this Thanksgiving, I'm like, I'm going to talk to everybody about this in my family. And of course, they know what my point of view is, but the importance of me talking about it with normalcy, talking about what was at stake, talking about it to my family and my friends in everyday kind of conversations that we'd be having about the state of the world, just like we talk about anything, I think has really shown me, first, to not assume where people are, and second, to really let folks know, especially the folks immediately around you how critical this is, and what's at stake and what we can do about it, because all of those things are at our own fingertips. And so I want to pause there and see if Amber or Alexa wanted to add anything before we move on.
Yeah, I want to add that, it's actually something you might not think about, you might not realize it, but it's something we think about in litigation as well, how we can use litigation to destigmatize. And so when we use our litigation and we use our expert witnesses and our plaintiffs in particular as public education. And Amber has sat through many a trial in Louisville around abortion, and so I think she can also speak to when we have people on the stand, we are really having them tell their patients' stories, humanizing the people who are getting these procedures, the people who are providing these procedures. And I have really seen the shift, and I have really seen the impact that these stories can have in the written decisions. When I see a judge that we didn't even think was really on our side in the first place, just copying and pasting testimony just straight out of the witness's mouth into the opinion, you know that it has moved someone who probably didn't think about abortion all that much before. And if they did, it was sort of like, I don't want to think about it, I don't want to talk about it, that sort of thing. But when confronted with it and when really shown the sort of humanity behind the people who have abortions and the people who provide abortions, it really does change hearts and minds. So I did want to add that it is something that even, it's certainly not the thing you think about, like, oh, a lawsuit, that's really going to destigmatize things. But it's something we think about even when we're planning our litigation.
Great. Thank you for that. I just noticed the time, so I'm going to take us into a wrap up. Thank you all. Listen, we know we have a lot of work ahead of us to really protect and preserve reproductive freedom, bodily autonomy, and all of our personal decisions. And really, I'm so heartwarmed by just the fact that today we're on a call on a Thursday afternoon to talk about this. That shows us that we really are at a point where what we have and what's most important is each other. So I want to thank all of you so much for joining us today, sharing your questions, and thank you to Alexa, Amber, Jessica, and Suzanne, who's been doing ASL for us as well. Thank you so much, and thank you for taking the time to answer all these questions so thoughtfully. Thank you to all of you, our supporters, for joining this leadership forum today to learn about the ACLU's role, our collective part together in protecting abortion rights and reproductive freedom in the short and long term. Listen, we know the road ahead is going to be long and it's going to be tough, but we also know that collectively we can work together, and it brings me peace knowing that we really do have the majority on our side. Polls consistently show that now more than ever, a majority of people in this country oppose overturning Roe versus Wade. And so we're going to stay alert, we're going to stay engaged, and we are going to stay loud because we are in this together. And I know we weren't able to get to everyone's questions today, so please email us at leadershipforum@aclu.org. I believe we're going to drop that into the chat, but again, it's leadershipforum@aclu.org. Listen, this ACL community is truly like no other. With our incredible presence across the nation and all of you and our staff of lawyers, organizers, volunteers, and activists on the ground, we truly are stronger together. And we are grateful to have you all in this fight with us.